you can see the catheter coming down, this little tube, then I've injected dye, and this is the contrast within the vein, okay? So that first one is your obturator vein, okay? And then let's see if perfect. So the next picture is the coil now that's in that obturator vein. So that shows that vein's now been blocked off by the coil. Okay. Now the obturator vein is probably more important in people who've got reflux within the legs, but we know that it was refluxing in you as well. So we're taking a holistic approach here, and we're treating everything that was seen on the ultrasound effectively. So that picture there now shows that vein, which was the obturator vein, has got the coil in as well, and that's blocked. And next you can see the catheter coming down here into this vein, and what I'm trying to do is I'm trying to get into a vein that comes down this area, and that's going to be called your pudendal vein, okay? So then that image now shows the catheter. It's magnified up now, but the catheter is coming all the way down, okay, into this pudendal vein.
The dark area, like what looks like a shadow.
Yeah, that's the vein. That's the contrast sitting within the vein.
So that's how big it is.
Yeah, so that's how big it is.
And it's supposed to be as big as
I mean,
the catheter?
This vein is bigger than normally in the pelvis. It's that's probably roughly a normal size vein down here. That's still quite big and chunky, okay?
Okay.
And then another picture with the coils sat in those veins, showing that we've blocked that pudendal vein as well, okay? We then move to the opposite side. So you can see your hip at the side here. You can see this is your bladder sat within the pelvis. Remember, your vulval veins are going to be in this region here, okay? This again is coming down to this area where there's you see a little hole in the hip? Yep. Okay, or pelvis rather. So this is called your obturator foramen, and because of that, this is your obturator vein, okay?
So it goes
into it. Yeah, exactly. And we know that on the scan was refluxing, okay? So then we've got a coil then sat in it, and that's blocked now, okay? Then this is a subtracted image, so it's slightly different because you can't see the bones as much now. So what we've done is we've injected the contrast, which is the dark bit here, and everything else is kind of subtracted out. But because you've moved a tiny bit, you get this like little shift of everything. So instead of it being,
because I was shaking.
Yeah. So obviously instead of being completely clear white with dark, you can see it's a bit grainy, but that's just because of minute movement. But even breathing would kind of cause that to a degree. So, and I'm not going to ask you to stop breathing for that. And then that's the coil that's sat in that vein. And remember here, you can see these spidery veins that are coming down, and they're going to be going towards your vulval area as well. Okay.
And that's what you didn't inject.
So we did.
You did.
Yeah. So actually, I had the catheter here, and then I injected a little bit of the sclerotherapy agent into that.
Okay.
And that's kind of the picture at the end of your pelvis and what the coils will look like, okay?
Okay.
So that's your obturator vein, that's your pudendal vein. That's your obturator vein, that's your pudendal vein. And it kind of comes up a little bit, this coil, because that's just going into sort of what we call parauterine plexus, which is where some of the veins go off into the uterus itself, okay?
Because I had some refluxing veins around my uterus, so that's blocking those off now.
It is, but I suspect a large number of that was coming from your ovarian vein anyway.
Oh, okay.
Okay. So this here is now your tummy, okay? And what you've got here is you've got the catheter coming down. This horizontal portion where it comes like this is your renal vein, okay? And then it dips down and goes into your ovarian vein. So this is the start of your ovarian vein that comes from about up here in your tummy, okay? And goes all the way down into the pelvis. So the dark shadow to the right of the screen or the left of you, this branching thing here, okay, this is your contrast within your kidney. So your kidneys are pacifying because you're peeing out the contrast.
Okay.
So that's why it's called a nephrogram, okay? But this here is what I've injected, and that's the vein, your ovarian vein on the left.
Size of your thumb.
Yeah, and normally you would see that as, you know, the size of the catheter itself. Okay, maybe a little bit bigger, but not that size. And of course, you're lying flat as well, so it would be even bigger when you stood up that vein.
Right.
Wow. And then more distally, this is your left hip. And this is down in the pelvis again where I've got the catheter. So we've then put in a coil there. So we're blocking that whole vein, and this is midway along the vein. And again, we put a coil in. This is the top of the vein here. And then right at the end, that's showing the full length of the vein that we put the coil in on the left. Okay. So the order of the images goes all the way through to that. Okay. So it's a nice little story that tells you where I started on that left-hand side, blocked the veins, moved on to the right side, blocked those veins, then moved up into the tummy, blocked the ovarian vein.